Sharon, are you ready?
I'm ready.
Excellent. Well, welcome, and thank you for joining us today. This is the first in a two-part series or two standalone webinars, depending on how you want to look at it for your campus, on evaluating your prevention efforts on campus and identifying where to go next with next steps in your process and whatnot. And so we're pleased to have our friend Sharon Wasco joining us again and providing her expertise in this area, as well as the work that she has done previously with our campus climate surveys and providing that data and feedback to campuses on next steps. So Sharon, thank you once again for doing this for our campuses in Ohio. I will monitor the chat room should anybody have any questions at any point, and pass those along to Sharon when she is ready for them in the presentation. We will go ahead and get started. So Sharon.
Great. Thank you, Carrie. I'm happy to be here this afternoon and continue moving us towards prevention. And so thanks for advancing the slides. We'll kind of move through these quickly. I think you sort of know. But I've been thinking about today's talk as a webinar in 3 acts. So we're going to start with kind of talking about what some friends of mine in Alaska that have been doing prevention work for a while talk about a prevention tipping point. Then we'll talk about some of what we know in terms of best practice, what the CDC has identified, some prevention strategies. And then last, I want to take the opportunity to share just some of what we've learned from another state that's taken a similar approach to kind of moving campuses to comprehensive sexual misconduct response and prevention. So we can move ahead to the next slide, Carrie, and I'm just going to start with what we all know is the river prevention parable, and I'm hoping and assuming most people kind of know the story of the fisherman standing at the side of the river, or the picnicker, whoever it may be that you envision on the river's bank, who pulls out folks who are struggling and pulls them out and drives them off and gives them mouth to mouth if necessary. That's the idea of responding. At the point of outcry, you hear that a little bit too when people come forward, as opposed to what you see on the slide on the upper right of that is upstream solutions. So the story goes, when it becomes burdensome to be pulling people out downstream, we sort of find ourselves turning upstream. What is this that's causing people to fall into the river? So we have these upstream, downstream solutions. I just kind of want to get that language out there. I do kind of shift between these terms interchangeably. So tertiary prevention is that response or post-sexual violence, sexual misconduct intervention. And then upstream, often I'll talk about that as primary prevention, stopping sexual violence before it happens. And just to throw one more term out there, when I talk about comprehensive prevention, it's often this idea of thinking about holding both of those buckets of work together at the same time, so doing that work together. So if you want to advance to the next slide, when we start to think about what do we need to actually turn upstream, the first thing I want to talk about is the prevention tipping point. So I've drawn I've overlaid on our vision of the river here an X and Y axis, and there's at least 2 things that we want to think about when we're thinking about how to take our prevention work forward. One is along the x-axis, the idea of time, and then the other one is really building that prevention capacity. And I know that we've kind of been saying this for a while, but I think that this visual really helps point it out. If you advance to the next slide, I just want to give a little credit where credit is due. These are folks in Alaska who have received for many, many years now, probably over 10 years, funding from the CDC to do Delta Focus primary prevention, and started with a lot of capacity building. So the next slide will kind of break this down a little bit more. We're going to go back to my visual, and that's this shape that looks sort of like a river. The line here is actually a way that we can think about prevention. And the thing I want to say about this is that change takes time, and it's not a steady linear climb. So this can be a little maddening, right? Because the impact, which is this third, what we call a z-axis that I've put over on the right hand, this would be the idea that sexual misconduct is being reduced, or that we're actually eliminating it. And the impact of prevention efforts is hard to see at first. So the river, the blue line there, is the work that the prevention efforts themselves. And the period of time where you really need to invest the most resources, both financial, emotional, knowledge resources, staffing, in terms of building those capacities and systems to be able to implement evidence-based prevention, is precisely the time when it's hardest to see your impact in terms of a decrease in violence. In fact, because one of the first observable changes that your prevention is working is an uptick in reporting rates, sometimes it actually seems like prevention is making the problem worse. So if we kind of break that river down on the next slide into kind of three parts, we can think about this as kind of getting started in terms of prevention capacity, building momentum, and then sustained prevention capacity. And the travel upstream up that river kind of looks, and again, this is pulling from years of folks that are kind of on the front line doing this work. You kind of start with the one-time events, awareness building efforts. As you there's a point around 5 years where it's like, oh, we can actually get more than one program implemented. We've got our campus clarity or whatever our online thing is, and we're doing some regular take back the night stuff, and we're bringing in some speakers. And then over on the right hand, upstream on the right hand and upper right hand of the graph, there is this comprehensive prevention programming where we really start to see the impact, where you can expect to see some reductions in violence. So if you go to the, yes, thank you. What do we need to turn up upstream? And again, I know this is the same thing we've been saying for a while. So on one hand, I've been reluctant to kind of say this again, but on the other hand, it's so important to hear about it and think about it and see it in different ways. So for some of you, maybe that visual kind of really drives home a point. The first few years, that left-hand side of the time axis is dedicated to getting your knowledge, building your partnerships, building community readiness on your campus communities, increasing your own team's internal organizational capacity, and beginning to really allocate resources, whether it's in terms of like hours that you can invest doing the work or dollars. So if we look at the next thing, the next slide here, I want to introduce a tool. One of the things, I think maybe it was Ann and Carrie and I were having some conversations at one point, and we said, well, it really would be nice to be able to help people do a gut check, I think we called it, of where are you in terms of prevention. So I put together a tool which you can get from either myself or Carrie definitely has copies that may be even accessible with the link to this webinar. And it's an assessment that at the end kind of can give you some ideas for next steps. And so while those, and I've kind of broken it down into high, medium, and low capacity. And the low is the gray column, and then the teal on the far right would be high capacity, with that middle ground being the lighter teal. And while those, there's probably nothing new that you're going to see in those next steps, I think walking through the process of how do you, what are some of the specific indicators. So we'll just go through these quickly. Carrie, I'm not going to talk about each category, but I did break it down into two big things. One would be preconditions for primary prevention, and don't move quite yet. I do want to pause for a moment on this slide, but the other thing then would be components of what would be considered, comprehensive prevention plan. So preconditions are really those things that you'd want to have in place ahead of time, whether we call it capacity or readiness. Both those things are a little bit different when you get into actually measuring them. Like I think about things in operational terms, but when you're on the ground, capacity and readiness are really kind of the same thing. It's getting folks to the point where they're able to do the work. One of the things I really wanted to say, because having had the opportunity to work with campuses over a number of years, and especially last year, being able to see results from many campuses' climate surveys, is that while sexual misconduct does not spare any campus community, it is more prevalent on some campuses than others. And I think we need to be real honest about that in an era where there's many things that campuses, any education outlet, society turns to them, and this is where we need to kind of direct resources to address problems. So educators have a full plate in terms of what they're expected to do with their students, with and for their students and staff and employees. So I do want to talk about the extent to which sexual misconduct is what I put here, pressing on the campus, because it can become an exercise of perhaps banging your head against a wall if you're trying to really do comprehensive prevention the way that I'm going to talk about in the rest of the talk, and it's not a huge problem, or it isn't pressing on your campus. So I thought about that in terms of, and this is something new that isn't on, I pulled from many resources to put together this little turning upstream assessment, but this piece is new. And so I think there's 3 ways that you can think about how hard is sexual misconduct pressing on our campus. One is reports, how many people are using your campus's formal procedures, and I kind of gave some general guidelines around what would be low, medium, high there. Prevalence, this is different. So reports are your formal procedures, whether you call them Title IX reports or however you talk about that. Prevalence is when we do these anonymous climate surveys, what percent of those respondents who fill out a survey are self-reporting that they've experienced the types of sexual misconduct that we've defined for them, that Carrie's team has done a good job identifying those 5 different types of sexual misconduct in the benchmark items. So again, looking across all the data that's come in, I have a sense of what's high, medium, low, and provide that to you. And then finally, you may be on a campus with a really strong champion for sexual violence prevention who says, I don't care if we have 0 reports and we're still going to do prevention. So the last thing I kind of tried to account for is what we call public will. And this is greatly influenced by our national conversation around sexual misconduct. And we've been bubbling, if not boiling, on this issue for a number of the most recent years. So it may be that just for, I hate to say it, political or public relations, this may just be an issue that has to be addressed. So besides that first little section, I'm just going to kind of go over quickly. Other preconditions are having your partnerships in place to be able to support prevention messages, that you have sufficient resources. Carrie warned me that some of those dollar amounts may come with some sticker shock when you read that, but I tried to be realistic about what it costs to do prevention that really will have observable effects at a population level, where we'll see rates of violence go down or sexual misconduct go down. And unfortunately, it does take those dollars. We can advance to the next slide, and I've got a couple more preconditions. This is your readiness. One is a commitment to prevention, and at the bottom there, part of a commitment from your leadership to prevention is making sure that the campus team collectively has the abilities and competencies that are necessary to actually do the work. So there's a little subscale that's been pulled in from some previous campus work I did in Pennsylvania. And then I think that actually ends on our preconditions, and those are kind of your readiness capacity measures. And again, the idea with this tool is just to get a sense of where you're at and maybe being able to target where you need to work a bit more. This next part, components of comprehensive prevention plan, a lot comes from the literature and the kind of work that's been done for years. I also went directly to Carrie in terms of how she's been measuring comprehensive or the necessary components to a prevention plan on some of the, with some of the work that she's done around supporting prevention work with campuses. And these will look very similar to people who are familiar with the 9 principles of effective prevention. We can kind of fast forward again through to the last page of that document where we talk about evaluation. So right here, I am going to take a quick pause because this is a 2-parter on really thinking about integrating evidence and data and evaluation into the prevention work that you do. And just want to say, while response protocols draw from the criminal justice model, prevention really comes from the health sector. So drawing especially hard from the public health model, which relies on interventions that target populations, not individualized treatment. So, this is population-based treatments is fluoridating the water. Individualized treatments are filling a cavity. So again, when we talk about those interventions that target populations, it's difficult to measure at that level. So I did want to say, because of such a strong pull from that medical and health sector, the use of scientific evidence is pretty much integrated into every step of that public health model, up to and including randomized clinical trials at the end, when we kind of figure out, like, does something like a green dot work, or is coaching boys into men really effective in doing what we want it to do? Well, they've actually done that kind of randomized control research, and so we are really pulling from a scientific basis of evidence. So later this summer, put in a little plug for June 27th, which is a Thursday, I'm going to present a webinar on the topic of prevention evaluation. Evaluation is a little bit more than just a climate survey. It does, when you're valuing whether or not a specific set of activities and programs is having the effect that you want, there's a little more to that process, figuring out what is it that you want that success to look like. So developing the logic model and being very specific with outcomes. So for many campuses, it may be the only resources and opportunity you have to kind of do evaluative work is to use that climate survey, and again, with as much evaluative thinking as possible. For campuses that are really doing, like, implementing pretty comprehensive, extensive programming, moving towards a more pre-post design or some more sophisticated designs, or maybe even qualitative designs, are things to think about. And that's not going to be today's topic, but hopefully we'll look at that a little bit later in the summer. So we can kind of fast forward through the next slide. Again, this is just when you get to the end. I didn't put numbers or rankings on this. I think the idea is you go through, you circle kind of, you use it as a discussion tool with your team, circle where you're at, and just kind of count up, are we more in the gray, light teal, or dark teal area. And that may bring us to the end of the first act. So we're at the end of our first act in this prevention webinar. I'm not seeing any questions in the chat box, so I'll move ahead. The second act that we're getting into here is really thinking about what strategies do we have available to us. If we're going to be evaluating prevention, I do want to take a quick look at what we know really works. So in developing prevention strategies, experts have amassed and combined what we've learned from behavioral science, market research, community education, policy research. And this is what makes prevention work so exciting to me, is it's so multidisciplinary and pulls from so many strong areas of kind of how do you change people, how do you change society. It also can make it complex. There is this tool available to you all, the Stop Sexual Violence Technical Package from the CDC. I'm going to go over, if you kind of go, I think you had advanced to the next slide, Carrie. Yeah, I just wanted to point out the title there, Stop SV, is each one of those letters is kind of an acronym. So if we start with S, each one of these strategies is attached to these letters. So, and they give examples of where evidence has amassed, like how did they come up with these 5 different strategies? Well, these are things where there is evidence suggesting that it actually works. And that is awesome to be at this point. 10 years ago when I was thinking about this work, we didn't have really any of the, we kind of knew maybe what was working on the ground, but we didn't have the research we have now. So this is a nice tool in that it's really grounded in where do we have science to support it. I'm going to make another visual analogy, so you can go to those circles, Carrie, where we had I'm not going to, you can read the tool. These are the STOP piece. So this is the stop. S down there is social norms. T is teach skills. O is provide opportunities. And P is create protective environments. So again, it's just a little heuristic to kind of remember these 4 different strategies. When we're talking about comprehensive prevention, the key to being comprehensive is the idea that these strategies all work together and they reinforce one another, and so they become synergistic and mutually reinforcing if they're designed to work together. So if we look at this visual, that's one of the things I really want you to remember, that we don't want to do these things as standalone. The idea is to try to kind of combine them. So let's go to the next slide, which I think is going to talk a bit about social norms. Oh, no, sorry. Start with teaching skills. This may be what many people do with community education, whether it's online or some of the work that you do to kind of just get the vocabulary out there first. We know that needs to happen, but eventually get to the point where we're really teaching affirmative consent, so the healthy sexuality piece, put the empowerment-based training for women to reduce risk for victimization. We do actually have evidence that some of the more empowerment-based, quote-unquote, self-defense programs really are actually effective. Teaching healthy, safe dating and intimate relationship skills, those communication skills. So this is something that I think, because you're educators, and I kind of started here on purpose, even though it's not the first letter that the CDC throws out there, we're starting with teach skills because, again, if you're listening to this webinar, more likely than not, you're employed by someone who's or an institution whose main goal is education. So teaching is really in your wheelhouse. It's something that comes naturally. The next strategy, and now I'm just kind of going clockwise, I think. So again, a little bit different than the way the CDC presented their letters. This isn't going to spell anything out for you. But wanted to talk a little bit about providing opportunities to empower and support women and girls. I'll just say 2 things about this. One is it's really exciting, some of the states that are doing Delta focus work we're really starting to focus on something like paid leave as, believe it or not, a strategy for preventing sexual or intimate partner violence. So economic supports for women and families and other ways to empower women is probably the least related to what you might do on your campus, but is a really exciting new area of primary prevention. What comes probably most naturally to people from a campus-based employer is the idea of Title IX. This is about providing the same opportunities for your female identified students on campus as you would for male identified students. So initially, I think a lot of what we thought about Title IX was, do female athletes get similar dollars in terms of hiring coaches or scholarship money or even practice time, field space? Are you providing equal opportunities there? Now we know that Title IX is also, are we providing equal opportunities for people across the gender spectrum to feel safe and free from harassment in order to actually take advantage of what they're paying tuition to do, which is learn. And you can't learn if you're in that unsafe environment. So Title IX is probably your biggest way that you would understand you're already doing primary prevention, and why the work that you're doing in Title IX, which sometimes some people will say, well, that's just response. From a big picture view in terms of preventing at the societal level violence, Title IX is actually a primary prevention strategy. It's an upstream approach. Another thing I wanted to throw out there, if you're one of those campuses where you're not seeing high prevalence on your climate surveys, or you're not getting it, you're truly that person who doesn't have anyone ever report sexual misconduct. Number one, don't count on that being the same next year. People may change. But number two, maybe think about ways maybe you can champion a leadership opportunity for young women, whether it's a STEM camp on your campus or something else that really just kind of works towards gender equity, because those are in fact when we go upstream and figure out why it is that people, the kinds of people that are falling into the river and how they get there, a lot of it has to do with some kind of systemic issues where people aren't provided the same kind of opportunities. So if we can kind of build in that work to the campus work that you're doing, again, that may be a way that you do prevention without having to talk about sexual assault and pull people into saying, well, that's not a problem here, that's not a problem here. Next slide is going to look at creating protective environments. You can see that the kinds of work on the left are already things that are being addressed with the Changing Campus Culture initiative, social marketing campaigns, creating cues in that environment that both from an emotionally protective position as well as a physically creating a physically safe and an emotionally safe and an inclusive kind of climate. There's work that can be done, and we call this kind of campus level interventions. And a lot of this, again, is consistently applying the protocols and policies that you do have already in place, like actually using them, actually doing what they are set up to do. And then, identifying some of those other risk factors at the community and campus level. So one of those is alcohol. Research has again and again and again found that the availability of alcohol is highly predictive of rates of sexual violence at a population level. Again, I'm not trying to victim blame in any one case, but the alcohol at the community level is a identified risk factor. Okay, and so the last one And I did kind of put this last, and I did kind of make it a green dot, is the bystander work that has become so huge and exciting in the past decade or so is really about promoting a new social norm where entire campus communities are called on to be active upstanders and champions against the kind of culture that tolerates sexual violence. And so I won't say a lot about this because this is, I think, a social norm, or I mean, a strategy that many of us have been looking at really closely. And I would guess if you're on this call, probably you're familiar with bystander approaches, mobilizing men and boys, and with the idea of changing group level behaviors, beliefs, and expectations about how campus students behave on campus. The last slide is a summary slide of this. And if we go to the next one, yeah, so the last piece down there, I do want to talk about what's in purple. I've made it a different color. This is the SV. So in the CDC's lingo, we've got STOP, the four that I just described and showed you little visual images of those circles. Those are four major strategies that I would really encourage you to think about in developing your comprehensive prevention plan. They're ones that have the foundation and the power of evidence behind them. The last one is just, I want to say again, when we pull out to thinking about prevention at any one community or county level, supporting victims is actually a form of primary prevention. A community level protective factor that's been found is having coordinated systems of care. At the individual level, one of the highest level predictors of whether or not someone will experience sexual victimization is whether they have previously experienced sexual victimization. So doing that important work of survivor-centered services and providing culturally relevant and developmentally appropriate treatment for your victims. And I would argue offenders in the sexual misconduct cases are really an important piece of a comprehensive prevention approach. The next slide just kind of provides some of what the CDC has identified as effective approaches. So they talk about strategy, which is the big circle, and then these are the approaches that have been tested with evidence. Okay, so these will just kind of go through, if you can move through them, this would be like a slide build out. So we're seeing all the strategies together to the extent to which they really do in this visual image kind of come together. The bigger that green dot in the center is, I think, is really where we truly have the opportunity in this lifetime. I believe it. That's why I keep getting up and drinking my coffee and doing this work. We really can stop sexual violence, preventing cases of sexual misconduct on your campus. And it's like, I think it's going to take leveraging all these different strategies and being creative with our approaches. The next slide kind of, I think, part of where we want to move today. If you've been with me so far and you're like, okay, I know all this, I think what we see is, and this is an image that sort of visually shows the idea of siloing, and also sort of overemphasizing some of the strategies as opposed to others. And this is more, I would say this slide probably pertains more to prevention work that's done in non-campus communities, so communities, neighborhoods, or faith-based communities, other types of communities. But we do want to kind of bring that together. So again, I think the power is in the overlap, and you can see in the next slide, I think we look more like the top image there. And again, the idea is how do we move towards that sort of rosebud picture at the bottom, where I think is part of the shift that we're looking for. And this is about to bring us to the end of Act 2. So I put to sort of foreshadow the idea of specific outcomes, which is what we want to talk about on June 27th. How would you really evaluate that? You would want to identify, and you don't necessarily need to do all of these, but kind of figure out what are some of the outcomes that we would expect, and then how can we measure them. And there's ways of maybe fitting some of this into your climate survey work, but sometimes maybe there isn't. And so you have to kind of come up with some additional data collection activities, some additional pulling together people to do some additional evaluative thinking about what those data mean to truly have that piece of what we call program evaluation. Program evaluation is, there's so many different data activities that we talk about now, whether it's quality assurance and quality improvement, or data, just different things, but program evaluation is a process that involves really specifying what are the specific outcomes that are linked to what specific activities. And this is an idea of some of the kinds of campus changes that you will see when prevention works. And again, at the top of that list is the increased reporting. So I think we're all at the point now where we get, like, just because reporting rates are going up when you start to become active in your prevention work, that doesn't necessarily isn't a poor reflection on the work that you're doing. It actually means you're kind of bringing the problem to the surface. And then, but it does take, up to 10 years, I think, on that initial tipping point, right, to get to those reductions in perpetration. My hope is that, now that we've gone through the process in different communities and have identified this tipping point and what it looks like, and we have a sense of the change trajectory, that we can figure out ways to accelerate that process so that we don't always have to wait for 10 years, that capacity building doesn't always have to take 5-6 years. I think, as we get more and more sophisticated in our methods and our solutions, I'm hoping that you can reach that tipping point faster. Okay. So the third act here, I'm going to pause again for questions. If anyone has anything they want to react to, put in the chat box. We have some time, and we'll probably have some time at the end of the talk as well to go over any questions. Okay, so seeing none, I'm going to move on then to the third act here, and I want to credit where a lot of this thinking comes from, which is the state of Indiana for a long time leveraged their RPE money, which some of you may have heard, that rape prevention education money. Each state gets a pot of money, and generally states have a lot of flexibility in how they use it. And in Indiana, a piece of their RPE money for many, many years, no longer, I think this INCSAP, which stands for the Indiana Campus Sexual Assault Primary Prevention Project, became defunct. I want to say it was 2014, but before they did, I was in close contact with the work that they did, and this young woman, Lindsay Ann Bassick-Stoley, did her dissertation kind of evaluating the work, and I was an active, I was involved in helping her with some pieces of her dissertation, which means I had full access to it and was able to do some secondary data analysis. So she pulled at that time from what was, this was like 2013, 2012. One of the great resources we had available at the time was put out by the American College Health Association called Shifting the Paradigm. Again, talking about the very same thing I'm talking about here again today, primary prevention of sexual violence on campus. And she used that to develop a tool that was meant to evaluate the work that the Indiana Campus Sexual Assault Primary Prevention Project had been doing for years. And she was a program coordinator at that. So she was involved both as a researcher and a program coordinator. All right, So what was the Indiana Campus Sexual Assault Primary Prevention Project? If it looks familiar, it was similar in some ways to the statewide initiative, the Changing Campus Culture. If you want to go one more slide, let me see if it's the next one. Yeah, this kind of talks about what they thought were, at that time, the 6 key components. A lot of the same stuff they talk about coalition building. We've been talking about partnerships, right? Male involvement, bystander intervention, social marketing, data collection, and policy work. So the same kinds of things that we've all been doing on campuses for many years. And again, really emphasizing this comprehensive approach and looking at risk factors and solutions across the entire social ecological model there. Those little overlapping ovals, which I'm sure are familiar to many of you. So this is a project that was chosen as an exemplar of innovation in primary prevention by the National Sexual Violence Resource Center, again, probably around 2013, 2014. And similar to what's happened in Ohio, while those key components were kind of picked out as like, okay, we need to be thinking about all of these things, the way that actually was shaped and taken place on different campuses was unique to that campus. And it's sort of like survivor-centered work or person-centered therapy. Like if you're truly a community practitioner, every community is different. So that has always been a hallmark of this work. If we take a look at the next slide, what I want to do is kind of go over what data, what was found. And so I'm just going to, this is going to get data heavy for a minute, but I want to kind of show where this is coming from. So Lindsay created a total prevention score and essentially recruited 11 different campuses across the state of Indiana were recruited and agreed to participate in her dissertation work. It involved a quantitative and a qualitative component. And so the quantitative component was a survey that had essentially, let's just say 70 questions or 70 points. And if we look at the next slide, okay, this is perfect. So there's these 4 sections of the survey that look at the extent to which campuses are using data, what their policy work was, the kinds of let's call it like the dosage of education that they were doing. Essentially, it's like who were they educating and other efforts. And before you advance to the next slide, which you can do in a second when I finish this thought, I just wanted to point out that there were 2 pieces that Lindsay looked at in policy and that Indiana group really tried to emphasize was defining primary prevention in the policy. And when I say policy, this is like what many of you may refer to as your Title IX policy, making sure that the policy had primary prevention defined and that there was a plan was included as a piece of that policy work. Education, okay, that's good, perfect. Other efforts, what were those other efforts? Well, a lot of that is what we've kind of been talking about as social marketing or awareness work. So it's pamphlets and posters and kind of saturating, making sure that information is out there. This was bringing in speakers, giveaway items, things that essentially just kind of, again, we kind of have been talking about this as community education, or I'm probably going to get this wrong. I want to say it's recommendation 3, the widespread communication campaign. We can look at the next slide. And you may have been noticing, if you're aware, on the left-hand column, I've been kind of showing where there were relationships. These are the last 3 components that were included in the survey, so I just want to get those out. So there were 1, 2, 3, 4 that we've already talked about, 4 sections on the survey. And then the light blue and the dark blue that you're seeing on the right-hand side of your screen were 2 more prevention-oriented sections of the survey. And then the green is an additional 7 questions that were asked about what kind of support did you get from that Indiana group, the INSCAP group, what kind of help did you get in doing the work that you did. And those 3 things, so while those little arrows are showing the extent to which, and mathematically we talk about this as kind of components that kind of hang together mathematically. So all of those other components were sort of, were statistically related to the total score. So that basically says these kind of things kind of make up what campuses are doing consistently. And the 3 rectangles on the bottom, so the green one, which wasn't included in that survey, and then the other 2 blue ones were not statistically correlated with any of the other subsections of that survey, which means we have a lot to learn there. So if we go ahead 1 or 2 slides, let's take a look at what these things are. So 1 is really developing that prevention group. So if you look at the dark blue that is not hanging together, it's not playing nicely with the other squares in the sandbox there, that is the existence of really having a strong prevention group. And the questions were phrased, you know, not about a response group or a sexual assault response team, but a group of people that are really working together on prevention. Does it meet regularly, and does it include these kinds of folks? And when you go back, and I hope that you do, and take a look at that Turning Upstream self-assessment tool that we looked at in quote unquote Act 1 of this talk, a lot of these same ideas are kind of measured in those 3 rough categories, like, you know, how regularly does the group meet was one of the questions, and then, you know, how many different kinds of groups does it include. In the middle there, this is what we kind of would talk about as best practices in prevention activity. So again, other efforts was kind of what we generally talk about as awareness building work, those 9 points that are correlated up there. And that's kind of what most campuses are doing. These 3 things on the bottom kind of set campuses apart. And so I like to think about it as like at the time that the survey was done many years ago, not every campus was able or ready or had the capacity to do prevention work, and I think that's still probably the case. If you look at what those prevention activities were, those 12 points really do get at, you know, are you encouraging the involvement of men? Are you actively addressing consent, addressing social norms, teaching skills, using, addressing root causes? A lot of that kind of best practice. And then we'll talk a lot about prevention support, so I don't need to say too much about it, but they were kind of 7 different ways that you might seek outside help in terms of building the work that you're doing on campus. And the bottom line to that entire slide, you can stay here, is that stay here. There was no simple relationship to those 3 boxes at the bottom. So if that's not driving, I said, well, let me go in and see, is there anything else? Is there any other way we can make sense of these data? And so again, all of those boxes that we just looked at are in the right-hand column of this slide, with the exception of the green one, which was always a little bit different anyways. So we can think about the extent to which you're doing comprehensive prevention is that green column. Prevention support from the movement, again, that's sort of, you know, we could think about that here in Ohio as prevention support from ODHE or wherever else you're getting it from. Resources for prevention in purple, that's really like to what extent is your campus ponying up time and money, and then institutional characteristics. I'm looking at my time, and if you want to just kind of go through quickly here, I'm not going to, just sort of point it out. So some correlations are being found. These are arrows have I put arrows on both ends of these because it's correlational research. But what I'm pointing out here with just kind of drawing this diagram is it gets really messy really quick. And so if we go to the next slide, I think that if we want to understand how to best support prevention, we need approaches to control for some of this mathematical noise. Like this looks really noisy when you look at trying to untangle statistically what's going on here. So a piece of that again is what we might emphasize on June 27th and the second of these two webinars. If you advance another couple slides in to lesson 2 that I kind of took away from this, if you take away those lighter arrows and look at like what, and there was some difference between, you know, how significant the findings were, these were essentially the strongest findings. And if you can see, it's all kind of linked to money. Not to be crass, but I mean funding matters. So again, if I'm trying to give lessons to how can we help prevention, how can we really move prevention along, I mean, I want to say the best thing I could do if it was me is like partner with a campus to write grants. If we really want to talk about what it takes to do this work, I hate to say it, but it does take money. So that's lesson 2. If we advance, lesson 3, to me, is that figuring out how to, from the outside, because I am on the outside now and work with a lot of people on the outside. So I think maybe Ann Brandon is on this call from the Ohio Alliance to End Sexual Violence. Their entire organization is, you know, in for the long haul in terms of how do we help campuses support prevention. And I think that I need to say the road is not probably linear. Carrie, we know you've been working for multiple years now on how to support prevention on campus, and I wish we had like an answer, but the evidence we have is that, you know, this is not necessarily linear. So I want to advance in the next slide. I said, okay, well, I'm not really happy with that answer. You know, and again, part of what you see is there's no arrow. There were no arrows between this prevention support and anything else in comprehensive prevention. So I kind of didn't accept that and dug in a little bit deeper. So let's take a look at the findings a little bit differently. So it does become a little bit important to understand how this was measured. And so for each of the types of support, which included money, training, newsletters, emails, technical assistance, campus visits, prevention materials, and a sort of generic other, campuses were asked that participated, answered yes or no. And so we can look at this another way. The next slide will show that when I I'll go ahead one more. These were the scores. If you added up like 1 to 7, I had to kind of standardize the scores. But this is 1 to, you know, this is how much support of those 7 things that 7 types of support that the different campuses used. And you can see, I originally thought, well, maybe this is an artifact of measurement, that there just wasn't any variability in how much prevention support was used. So therefore, we couldn't expect to see an effect because either everybody got nothing or everybody got the same amount or everybody got high. But you can see there really was a nice spread. And if you go through another couple slides, it actually was pretty equal in terms of low, medium, and high. So you can see the campuses were in fact utilizing support at different rates, meaning we should be able to see differences because there is difference in how much support they're utilizing. We couldn't see it this way though. So I said, well, let's advance. And you can just go through all of these. Essentially, this was the same data that I just showed kind of with the arrows, but just showing you lined up. With the green is support, and you can see there's no consistent pattern where we're going. What you would want to see is like everything all small, all the bars small on the left, and all the bars high on the right, and that just wasn't the case for any of these. So I said, well, let's look at it a different way. And if you want to advance, just kind of ignore this. I'm looking at my time. So we can actually, within each bar, go to the next slide. This is no longer each campus along the bottom. Now this is the type of support along the bottom, and on the y-axis is how many campuses used each type of support. And so you can see in this case, 9 campuses received money, 2 did not. 7 campuses received training, 4 did not. And I went through, and we'll go through them pretty quickly, looking at time, and looked at mini grants. So let's look at the 9 who received support. And this is more of a program evaluation approach. Like you're looking at the difference between those who did get this program and those who did not. However, if you look at the next slide, you'll see that there were no significant differences. And that pattern plays out for all but 2 of these bars. And so you can advance through all the slides. I don't have time to walk through all of them. 4 campuses had training. Okay, just note, you can keep going through, Carrie, but emails actually had an effect. So that was interesting. Site visits did not. Materials had a negative effect. The next slide, I think, is newsletters had no effect. And then technical assistance, 3 campuses received it, 8 had not. This was the highest significant difference was found here. I want to point out this was an N of 11. So the fact that we didn't see effects for most of those is actually probably less surprising than the fact that we did see a statistically significant effect. So generally you want a sample size of about 30 to be able to detect an effect mathematically. So to find a statistical difference between technical assistance between those who did receive and those who didn't, and for it to be highly significant with an N of 11 is big news. And again, it's correlational in the sense that it may be campuses that were already farther along in their prevention work than reached out to get. I'm not saying it's causal, but what I am saying is there is a relationship between utilizing technical assistance and beginning to make some headway on prevention, specifically in terms of prevention, having that prevention group in place. So that is a big plug for relationship building for anyone who does this kind of work. The types of strategies that actually get prevention going do rely on relationship building. And then we'll take a look at the next slide, or a couple steps. And so I just want to plug, you do have these opportunities. ODHE continues to provide training and technical assistance opportunities, both in terms of climate surveys. I'm aware that there's another request for proposals out to do climate surveys. Again, I would encourage any campus who's interested in prevention to take advantage of that technical assistance. It is one piece of evidence that links to, statistically linked to better practices in prevention. And we're at 2 p.m. Carrie, I'm going to let you give your thoughts here. My idea would be to spend the next 5 minutes. If anybody needs to leave, completely understand it. Maybe just running through the qualitative data. It's affirmative, if anything else. If not, I'm happy to close here too. What do you think?
Yep. Well, I actually have a meeting I'm supposed to be at right now, but I will text that person and let you finish up if we can wrap it up in 5 minutes.
Yep, let's do it. I appreciate the leeway. Of those campuses, 4 of them participated in one-on-one interviews. If I were to do this talk again, I'd probably put this information first, because with an N of 11, your qualitative data are really the more appropriate data to look at anyways. So let's take a look at those. Of those 4 who were engaged in the interviews, they all had received they had all worked with that Indiana program. First thing, that shift to primary prevention is hard. It's difficult. So this was an emergent theme that came out in the interviews. Like the things that we've been talking about, it's slowed by a lack of resources, a lack of institutional support, a lack of understanding about root causes. One thing, and so let's take a look at, there were a couple of nice quotes that I pulled out that illustrate this emergent theme, which is, it's a shift. You know, turning upstream is a pretty hard pivot point. I'm guessing that Carrie is using her hands to send her text, which I so appreciate her making the time to get these last 5 minutes in. This is a quote of what that emergent shift looks like, that hard pivot. And I just want to say, towards the center of that quote, there need to be things that are done more than just raising awareness and saying, hey, this happens, because telling students, hey, this happens, here are some statistics, that's not really going to change anything. There's more to be done. And that's precisely why I'm including that STOP SV technical package as ways of knowing there are specific strategies that work. It's not enough to raise awareness. We do need to do specific things, and we have at least 4 strategies with CDC-backed research behind it that say this work. The next quote is similar to that time issue, and I illustrate these just because if you're watching this webinar, this may feel like your life, we're making these efforts. It just seems like they're so small and slow, and we wish it would have happened yesterday. So this is all just to say that prevention tipping point is real. Hang in there. Keep putting one foot in front of the other, because it does take time and it takes capacity. And also know if your campus is one of those ones that isn't going to ever get those preconditions in place, that you might not need to totally go upstream. If you've only got a couple people that you pull out at downstream, you may not need to turn upstream. I don't know if I'm allowed to say that. I probably should have checked. That last bullet point on the first slide about emergent themes is, what is a driving factor in getting this work done? Well, compliance. Compliance is a big thing. Some of you probably have compliance officer as one of your multiple job titles. And as we continue pushing policy and legal mandates and get, case law on the books, like that is the kind of thing that will help support this work for the long haul. So another emergent theme that came from those qualitative interviews is the use of online programs. Again, this is going to sound exactly like what we've been hearing, what we've been seeing, what you all have been experiencing in Ohio to get to compliance. One of the ways you do that is start with that community education, get those modules in place. There's nothing wrong with online education per se. It's one piece of it. It's that blue circle. We know we need all those other circles working in concert to truly reduce incidence rates. It's interesting, again, these interviews were done about 6-7 years ago. They say, I don't know whether or not it's going to have any staying power. I think those of you on the line could probably answer that. I think that online programs has been one of our strong tools in this work. The next emergent theme is the influence of resources. I'm not going to, say this again, except that you can see it here. It comes out in all analysis of this issue. Money is necessary. If we had more time, we could talk about this a little bit more, but you've got people saying, hey, when my grant is over, I'm going back to my regular job. I know here in Ohio, a number of campuses have worked incredibly hard to get outside federal funding, and you probably have witnessed the same thing when those grants are over. It's really hard to sustain that funding, but it's critical if we want to do it in the long run. The next emergent theme, and this is when, where I think this is the initiative is called Climate Changing Campus Culture. The institutional support, one participant said, this may actually be more difficult to identify and acquire than funding. You know, there's no grant that you can get that says, you can't go to the federal government and say, hey, can I write a proposal and you send me some ample buy-in and understanding of the need for this work from my president. Like this is the hard changing hearts on the ground work. But it does happen and it does exist. I think this may be the end of my talk. I see I'm at 2:06. So if you want to fast forward, you can skip all this, just put my email up. Institutional size, you know, base of evidence. Oh, apparently there are more things, and these are important, but I want to be mindful of everybody's afternoon. So last plug is contact me if you have any questions, and try out that Turning Upstream self-assessment tool. Let me know what you think. I'm completely responsive to making any changes in the language and hope that it is a useful tool to help you get a gut sense of where you are in your work and where you could potentially go. And thank you all.
Thank you all, and thank you, Sharon, once again for your time and your expertise today. A recording of this webinar is available. If anybody would like to review it, just email me directly. And if you have questions or want to touch base with any of the slides, with Sharon about any of the slides she was unable to fully cover today, she has provided her contact information. And once again, Sharon, truly appreciate all the work that you do in this field, and especially your contributions here in Ohio. And so thank you so much, everybody, and thank you, Sharon, for being a part of this today. Everybody have a wonderful day. Get out and enjoy the sunshine. Thanks.